Story 1. This man repeatedly came to my unit because he was aspirating on something. He had a tracheostomy and a feeding tube in his stomach, so we were confused as to why he was being admitted every few weeks for aspiration if he wasn't consuming food orally. We eventually learned that his sister or wife had been pouring whiskey down his trach. To make matters worse, he attempted to grop every female nurse and technician who cared for him. Story 2. A patient's insurance company refused to pay for a positron emission tomography scan. When the patient offered to pay for the scan out of pocket, the insurance company stated they would deny coverage for any treatment, testing, or follow-up based on the results of the scan, even if she paid for it herself. This was one of the most unreasonable actions I have witnessed from an insurance company in a long time, and I encounter such issues regularly. Edited. It was Martin's Point Insurance. Story 3. I have mentioned this case in the past. An elderly man came in during the middle of winter. His legs were frozen to mid-thigh, truly ice block frozen. At the same time, he had numerous serious burns all over his torso. His gas had been cut off in the winter, which is technically illegal if the gas company has documentation of an elderly or disabled person in the home. He had been trying to keep warm with an incandescent light bulb. He kept falling asleep, and the bulb would fall on him, waking him up and causing small, fairly deep burns. He underwent immediate lower extremity amputations, rewarming, and was transferred to the burn unit. He sadly passed away within a few days. The level of suffering he must have endured is immense. To this day, it remains one of the saddest, most preventable deaths I have ever witnessed. Story 4. I worked in a neonatal intensive care unit. A woman had a very premature baby at home, around 25 to 26 weeks gestation. She and her partner decided to place the baby in a tube sock and then in a shoebox to transport it to the hospital. However, they got hungry and went through a McDonald's drive-thru with the very tiny baby in its sock-lined box. It wasn't just that they utilized the drive-thru, but they also shared the story with others, not realizing it might be considered an unusual choice. Fortunately, the child turned out reasonably well. Story 5. 20-year medic. It's challenging to determine what the most shocking experience was, but I once had a patient on hallucinogens who completely removed all the tissue from his left forearm, down to the radius and ulna. He was just relaxing as if everything was normal. It was astonishing and certainly makes the list. Story 6. I am a psychiatrist. Recently, I had a 6-year-old child with behavioral problems who had a breakthrough with his therapist, expressing that he feels unloved and needs more affection from his mother. The very next day, during his appointment with me, I informed his mother of this. He looked at her, and she replied with "okay," before returning to her phone. As a father, that broke my heart into a million pieces. I have encountered murderers, psychopaths, and even interviewed serial killers, witnessing the depths of humanity. But a mother ignoring her child's cry for affection in front of me? This is how we create monsters. Story 7. Emergency physician. I thought I had seen it all until a few months ago when I had a septic patient whose source I couldn't determine. I admitted her, and she was a boarder in our emergency department overnight. On the next shift, a nurse came out of her room and said, "Doctor, I just caught the woman injecting something into her peripherally inserted central catheter." The woman was injecting a slurry of her own waste into the catheter. Story 8. During my time as an emergency room resident, I encountered a severe burn victim with approximately 70% full-thickness burns. He was brought in barely alive after being trapped in a car that caught fire following a crash. His body was completely charred black from the mid-chest down, and parts of him crumbled off when emergency medical services moved him to the stretcher. I have no idea how he survived long enough to reach the hospital. It was the most horrifying experience I have ever witnessed. I think about him multiple times a month, despite this incident occurring 7 years ago. Both the trauma and emergency room attending physicians agreed that this was not a survivable situation. We managed to establish an intravenous line in his neck and administered a fentanyl drip for comfort, after which he passed away very quickly. Reflecting on this case still makes me feel sick years later. I cannot imagine what he had to endure. I have never seen anything like it since. Story 9. There was a taxi driver with gangrene in his foot. You could see through his foot between the metatarsals, and he refused amputation because he needed whatever was left to drive his taxi. Story 10. I once had a psychotic patient jump in front of a truck, breaking nearly every rib on his right side and collapsing his lung. Remarkably, he did not die and managed to walk home, where he amputated both of his feet and partially severed his right hand. He was discovered only after a neighbor found one of the feet in the garden. Never underestimate what someone will do in extreme situations related to mental health. Story 11. The first code I witnessed was an elderly woman who was vomiting feces. She had suffered a stroke several years prior, and her doctors believed she was silently aspirating, leading to a pneumonia diagnosis. Additionally, she experienced severe constipation that resulted in a bowel obstruction. The stool had backed up to the point of causing reflux, and after a gradual deterioration, she expelled a significant amount of feces, coded, and died. During post-mortem care, when we rolled her to clean her and change her sheets, more feces that had been lodged in the back of her throat continued to dribble out of her mouth. Story 12. Emergency room registered nurse here. The baby was born en route, coming from 4 hours north. The baby is a preemie at 29 weeks, with no esophagus, no soft palate, no genitals, a severely deformed spine and extremities, only one leg, and is not breathing on its own. None of the organs developed anywhere close to functional. The mother had a long history of substance abuse, including throughout the pregnancy, with no prenatal care despite her community trying extremely hard. Other children have already been apprehended. Additionally, the mother was hemorrhaging significantly. This was not necessarily the most shocking situation, but it definitely sticks with me. One of the paramedics who brought them was absolutely distraught. To edit, the mother ended up recovering with no complications. The baby was kept alive for 7 hours before the mother finally withdrew care and passed peacefully in her arms. Story 13. As a former emergency medical technician, I always believed that babies took time to be born. However, that is not always the case. I assisted a woman who did not speak English. She was very pregnant, and we kept trying to tell her to calm down and breathe. However, she was just screaming, and in an instant, a baby emerged into her sweatpants. We cut off her blue sweatpants, and there was a baby girl. Just like that, it appeared. Story 14. I've answered this before, so here it is again. Spoiler alert for those who are easily triggered or squeamish. Skip to the end. I was on vacation with another paramedic when we saw an accident happening in the distance on the highway. We were in the funnel to get by. There were no police, fire, or emergency medical services on the scene, and it was severe. So we stopped to help. This was in the early days of cell phones, but we had one, and we called it in. I should have known by the smell what was going on when I opened my car door. Diesel, body parts, exhaust. I will never forget that smell. Internal organs have their own distinct odor, and if lavender were involved, I would be repulsed by it for the rest of my life. The Department of Public Safety report stated that a pickup truck, traveling at 80 miles per hour, blew a tire and went into oncoming traffic, colliding with an 18-wheeler. This caused a head-on collision with a family car at about 120 miles per hour combined impact, and the force from the vehicles unable to stop pushed the family car under the cab of the 18-wheeler. The vehicles were so badly mangled that you couldn't identify the pickup. Triage is a system used to assess injuries and determine who will receive help. You look at the dead or dying and realize you can't help them, so you move on to someone else who is dying but whom you can save. I had to do that. There were 5 fatalities. The pickup truck driver was in pieces, literally. The 18-wheeler driver had to be airlifted to a trauma center. 3 others were transported to the emergency room with serious but non-life-threatening injuries. An hour and a half later, we were still trying to remove the cab from the family car with a heavy-duty wrecker, even though I had already lost hope of finding anyone alive. Relatives of the family in the car had passed the accident but didn't see the vehicle as it was crushed beneath the cab of the 18-wheeler and was unrecognizable. They returned to the scene when their loved ones, whom they had been following, weren't at home. The Department of Public Safety, fire crews, emergency medical services, and wreckers had been on the scene for a while. My friend and I had taken a back seat to the rescue efforts by this time and were preparing to leave, as we would only be in the way at that point, when the family approached us to ask about the details. The rescue effort intensified when I informed the captain that the potential occupants of the family car included a mother, father, grandmother, and a one-day-old infant who had just been released from the hospital a few hours prior. They were the other 4 fatalities. It hit me like a ton of bricks, just as vivid as the day it happened. Story 15. A potentially disturbed individual exhibiting extreme behavior and self-harm. He was one of the most challenging patients I have ever cared for as a psychiatrist. Story 16:1. A plant growing out of a homeless man's abscessed jaw. A man experiencing a sustained erection after injecting cocaine directly into his penis, treated by manually pulling blood out of his penis every 20 minutes for 10 hours. A man who transported his testicular mass to the clinic using a cart, as he was a farmer. Another man was asked to bring a urine sample the next time we saw him in 2 weeks. He saved every drop of urine to bring to us. His wife was getting upset because he was using all her mason jars. There are so many remarkable stories. These are wild times, and I'm not even a urologist. Story 17. A child, fully conscious, arrived at the hospital with a trident speared through their skull and into their brain. A man involved in a bicycle accident had his face severely split open from the center of his forehead to his mouth. His eyes were shifted so far to the sides that he resembled a chameleon. Story 18. I cut into a man, and the bones in his body were green, resembling moss. It turned out he had taken a lot of tetracycline as a child, which caused this unusual coloration. It was absolutely wild. I also undressed a deceased woman to perform a physical examination. After removing her shirt, I noticed a growth resembling a head of cauliflower in her genital area. It was the worst case of genital warts I have ever seen. Story 19. We had a devoted lady who visited her barely conscious elderly parent regularly, coming to see them every 3 days. She was taking fentanyl from the patient's patch. We only discovered this after she collapsed several times and had to be revived. It was really sad. She stopped visiting when the patch was no longer being used. Story 20. A few months ago, he had a 108.4-degree fever. This may not be surprising, but he is still dependent on ventilation, with no signs of brain activity. Story 21. The thing that shocked me the most after working in an emergency room was not the blood or trauma. It was how awful people can be, and how often bodily fluids and solids are used against you when you are trying to help them. Story 22. Mental health crisis worker. I worked for a lockdown psychiatric unit with a heavy population of sexually violent predators and just an all-around scary group of men. On this particular day, it was an all-female staff with the exception of one small man, and we were all tiny people. Management was inadequate and the staffing was poor all the time. We had a sexually violent predator, a man aged 32, 6 feet 3 inches tall, weighing 375 pounds. This man was a mountain who liked to hit his head against the wall until he had large open wounds on his forehead. He loved seeing blood, playing in it, drinking it, and collecting it. It didn't matter where the blood came from or how he got it. It was just endless fun for him. The day prior, he had hit his head in his cell and needed to have his head stapled shut before being sent to our facility for mental health treatment. We had him on a 1-to-1 observation. He had his back turned to the staff and used a psychiatric pen to help dig out the staples. It quickly became apparent what he was doing, and my coworker hit the alarm, prompting the rest of us to come running. The nursing staff saw and ran back to the station to get our lights out injection. The patient had half of the staples out and used his fingers to pull the wound apart to get the rest of the staples out. Once he realized he could insert his fingers, he began shoving them deeper into the wound and trying to pull down on it before hitting his head on the wall. Blood was splattered everywhere. There was so much blood. It was like watching a real-life horror movie. He turned to us with a soulless stare, a flat effect, and drenched in blood, saying, "Your turn." He then looked at me and lunged towards me, prompting me to run away. He laughed like a hyena, saying, "Gotcha, it's just a prank," and then proceeded to sit down and play in the blood like he was in a splash pool. He was eventually given a sedative and transported to the emergency department. Story 23. We once had an old, frail woman in our care who developed a skin infection on her foot that worsened over time. It was becoming necrotic, presenting two options. Either amputate it and risk her life during surgery due to her frailty, or do nothing but keep cleaning, elevating, and bandaging it in the hope that it might improve. It was a moral dilemma that only her family could resolve. Death and comfort now, or prolonged suffering at the expense of constant pain. Her family seemed oblivious to her needs, treating her as if she were still in her prime, despite her inability to swallow solid foods. They would offer her solid foods, acting shocked when she began choking and required assistance. Ultimately, they chose not to proceed with the surgery for her and instead aimed to extend her life for another month or two. They were in denial about her condition. While it is sad when our parents pass away, I would never wish to prolong their suffering simply because I would feel sad when they eventually go. I was present when the nurses cleaned the wound, and it was disturbing to see. The infection was severe, with bone visible. No amount of painkillers could alleviate her discomfort during the cleaning process, which we repeated every few days. I held her hand as this nonverbal woman screamed during the procedure. Many in my area felt relief when she passed away. It was bittersweet, happy and relieved that she was finally at peace. Story 24. Registered veterinary technician with 21 years of experience. A 17-week-old kitten was declawed at home because he scratched the owner while playing. The kitten also had all 4 of his canine teeth broken, and his feet were burned with a lighter to stop the bleeding. I have 16 years of experience in emergency care. I've seen a lot, but this case made me cry while on shift. The previous owner was charged with felony animal cruelty, and the kitten now lives with me. He goes to work with me every day. Please note, I cannot provide photos of the cat in the comments, but I am happy to share them if you direct message me. Story 25. I treated a patient with frostbite on all 10 toes. He had gotten high on methamphetamine and walked 15 miles barefoot in the snow in a northwestern state. I came in to apply betadine to his mummified toes, and he didn't realize he was going to lose them all. A doctor had not informed him. I stepped out to clarify the situation, and I was instructed to inform him. As a registered nurse, I felt bad but did my job. He acted like it was nothing and continued to make out with his girlfriend. I suspected he was still under the influence of methamphetamine because they were all over each other while I was trying to provide wound care. I eventually told her she couldn't sit in his lap anymore while I worked. I was shocked that he was losing all 10 toes. They would mummify, break off, and he seemed fine with it. It was just strange, especially because he was only in his early 30s. Story 26. Not a nurse, but my brother dated one. She assisted in a case where a homeless man had been wearing jeans. When they wore out, he put a new pair on over the top, and later he ended up with 3 pairs of jeans on. He never took them off or bathed unless he jumped in a lake. His leg hair had grown through all 3 sets, so the medical team had to surgically remove them. Story 27. I had a patient who was a victim of domestic violence. Her spouse poured boiling bleach on her face. The skin was starting to liquefy from the combination of heat and alkaline burn. She was intubated quickly for airway protection and sent to a burn unit. Story 28. An autopsy on an otherwise healthy 30-year-old woman who died after a serious asthma attack revealed that she was almost 5 months pregnant with twins. No one was aware of her condition. It was the worst day ever. Story 29. A patient severed his penis and consumed it in front of the police. He was an inpatient in an acute psychiatric setting. He had been taking increasing amounts of a substance purchased online from China but could not remember what it was. Story 30. I have seen an incredible amount of things stuck up people's bodies. One patient with Munchausen syndrome who pretended to fall off a roof and land on a 5-inch screw. He literally used a drill to put a screw in his own lower back. But the one that got me was Spatula Man. I am working one afternoon when we get called out for a patient who called emergency services for pain in an extremity. I respond, and my partner and I find an older gentleman sitting on the porch. He is about 50, appears to be in no distress, and states he is the patient. My partner starts asking him what is going on while I visually assess him and see nothing wrong at all. He is alert and oriented, does not appear to be in tremendous pain, and is chatting comfortably with my partner. He lets us know he would like to go to the hospital and can show us the problem once he gets in the vehicle. As he rises from the chair, I notice he is not very mobile, and there is a strong odor coming from him, despite his tidy appearance. At this point, we are both suspicious because nothing adds up, and we exchange glances, thinking this may be yet another surprising adventure. But we load him up, close the doors, and he just goes for it. He slides off his pants. You know those kitchen spatulas with a hole in the handle for hanging on a wall peg? He had inserted himself, flaccid, into the handle of an 8-inch spatula. The hole in this handle looks to be about 1.5 centimeters wide. I don't even know how he fit it in there. His testicles are bright red, and his entire scrotum is swollen. It looked like a speed bag for boxing. The man, who just revealed something I can never unsee, is still chatting with us like everything is perfectly normal. But I have lost all sense of duty and am just sitting there on the bench seat staring at this situation like I have unwrapped a golden ticket. The shocking part is that the vast majority of his extremity post-spatula is black, indicating tissue death. I still cannot even form words, but my partner immediately asks how long ago this happened. He said it has been stuck for the last 4 days. He explained that he and his wife were experimenting and stuck it in there, but when it started swelling, he began panicking when it would not return to flaccid. He attempted to saw or cut the spatula off but was worried about accidentally harming himself and stopped. However, he was too embarrassed to ask anyone for help, so he thought he would wait it out. I cannot imagine the amount of pain he endured rather than ask for help. Unfortunately, he lost most of his extremity due to this. I still do not know what he was thinking with this spatula or how his pride somehow overcame the amount of pain he experienced during that time. I am not even sure how he had a spatula stuck to his body while wearing jeans the whole time he was talking to me on the porch. In summary, please do not insert yourself into anything, including cylindrical objects. Story 31. Just before I retired, I worked as an emergency medical services lieutenant, the first rank of being a supervisor. I was stationed in a large city that had numerous radio frequencies for different sections. I was assigned to the border between the central and northern areas and monitored both frequencies to respond to incidents without needing dispatchers to relay messages. One night, the northern area received a call about a shooting. As I prepared to respond, I heard another unit in the central area dispatched to the same address for a cardiac arrest. My nerves were on edge, so I accelerated and informed both units that I was responding. Upon arrival, alongside police and a fire engine, we were greeted by the patient's girlfriend, who was sobbing but motioned us into an apartment that had an Event Horizon-themed makeover. There was an excessive amount of blood. We followed the blood into the bathroom and found a man sitting on the toilet, holding a towel against his head. He briefly removed the towel, revealing obvious arterial spray from his temple. He insisted he was fine and wanted us to leave, while the girlfriend claimed he shot himself. Neither statement was entirely true. The police began demanding to know where the gun was, but there was no gun. The man shot himself in the head with a crossbow, similar in size to a large pistol. He was transported to the hospital in stable condition and likely made a full recovery. While we were tending to him, one of the medics, who was one of the funniest people I had ever met, paused and said, "Between the 5 firefighters, 4 police officers, 2 emergency medical technicians, 2 paramedics, and the emergency medical services supervisor, there must be over 100 years of experience in this room. Has anyone ever encountered a crossbow injury before?" This was met with a collective reaction of surprise from everyone, realizing how bizarre the situation was. Story 32. One of the psychologists on our team was called in to deal with a new and distressed patient who had been admitted and placed in the tranquil room to calm down. While there, he found a pen cap and poked numerous holes in the one wall that was drywall. The area had to be closed for 2 months to fully clean and rebuild the wall. Story 33. An 8 by 10 sheet of paper, front and back, 2 columns on each side, lists allergies and intolerances that a woman brought to the hospital with her. It is laminated, It includes items such as saline in plastic bags, wet newspaper, toilet paper, and numerous medications, except for narcotics, of course. Story 34. First of all, you learn very quickly to never say never when working in healthcare. No matter how many years you do it, you will always see something for the first time, at the very least once every few months. That being said, there are still other things that shock me and creep me out no matter how many times I see them. These include teratomas will always creep me out. Many people already know what they are, but for those who don't, they are tumors that contain several types of tissue, including hair, teeth, and fingernails. The total lack of care for another's life is alarming. How people treat elderly family members is definitely concerning. The worst is always a parent's abuse of infants or children. I will never forget a skeletal survey of a 7-month-old who had just passed away, showing old and new fractures in almost every single bone in the body. Based on the aging of the fractures, that baby must have been beaten several times almost every day of their life. Finally, I will always remember a relatively young man, likely in his late teens or early 20s, who had inserted the rubber gripper of a pen into his urethra because he couldn't urinate. Story 35. Our intensive care unit had a woman whose ex-partner had attacked her by trying to make her drink bleach. The ex-partner then attempted to take his own life by consuming the remaining bleach. I felt some satisfaction in seeing how much worse off he was. Story 36. A man had such high blood pressure that it caused a severe nosebleed, resulting in bleeding from his eyes. Additionally, a significant amount of blood can flow from gastric or esophageal varices when they rupture. A few months ago, I suctioned nearly a liter of blood from a man's nose and mouth during the 10 minutes we tried to band his varices. The procedure failed, and the intensive care unit inserted a Linton tube, which they removed a few days later. He exsanguinated again and unfortunately died. It was a truly horrible experience. Story 37. Last winter, during a particularly cold spell accompanied by snow, a resident in the locked memory care unit, where I work, believed that the building was on fire. At 2 a.m., he took a suitcase from his closet and threw it through the window of his room, which was located directly above his sleeping roommate. This resident crawled over his sleeping roommate and climbed out the window to reach the firehouse down the road to get help. The firefighters called the police because they thought a homeless man was hallucinating. The night shift did not notice any of this until the roommate later emerged and asked for another blanket because he was very cold, and it was snowing on him. They checked, and sure enough, his bed was covered in glass and the resident was gone. It was a chaotic situation. Story 38. I am an exercise physiologist in a rehabilitation clinic for heart and lung patients, many of whom are recovering from open-heart surgery or aortic valve replacements. I have seen people ignore my and the doctor's strict warnings not to do anything that could reopen their healing chest scars. One patient had an inclusion site that appeared raised and bubbly during my physical assessment. I expressed my concern about its appearance and advised them to see the cardiologist as soon as possible. I also personally messaged their cardiologist and primary care physician to explain the situation. Both doctors approved their return to exercise. Unfortunately, while using a recumbent bike, the site ruptured, likely due to pressure buildup from fluid. Blood and milky pus leaked out along with the blood. A few weeks later, I encountered another patient who I later learned was septic. He had a heart rate of 170 and was so delirious that he fought me both verbally and physically when I called for an ambulance and refused to allow him to drive home after he had driven himself to the clinic. I am relieved he didn't cause an accident, although I ended up with a black eye for a while. I managed to make light of the situation by joking with patients that a resistance band caused my injury because I failed to follow proper safety precautions. Story 39. I used to volunteer for an organization that provided respite care for medically complex children. The most difficult experience I had was working with a girl who exhibited self-injurious stimming behavior, which is a repetitive action that some individuals with diagnoses such as autism use to self-soothe. Unfortunately, such behaviors can sometimes be harmful, for example, head-banging or scratching. Her stimming involved forcefully reaching behind her eyes into her eye sockets in an attempt to pull them out. The solution was to keep her hands busy with stimulating toys. However, when this behavior occasionally occurred before I could redirect her, I would feel nauseated. I hope she is doing better behaviorally now. No instance of cardiopulmonary resuscitation or wound care has come close to that experience for me. Story 40. I am an emergency medical technician. I believe I have posted this story here before, but here goes. An older female was being horribly neglected by her husband and caretaker. This lady, in her 70s, fell down early in the summer, and we had a crew go out there to check on her. She was alert and able to make her own choices. She refused medical assistance and decided to stay on the floor. A few months went by and we were called out there again. We walked into the small home and instantly smelled human waste and rotting flesh. She was still on the floor on the same side with a blanket covering her. We lifted the blanket, and she only had a shirt on. She was covered in waste with open, clearly infected wounds that had maggots in them. She was able to grunt in response to pain and nothing else. There were weeks' worth of waste in the tiny room where she was located. Her husband was behind us yelling that he could not do this anymore. We called for help and the police and attempted to move this woman. We struggled to move her because she had been lying in the same spot for so long that she had fused to the carpet floor with her bodily fluids. We pulled her off the floor like a band-aid, causing more wounds, and carried her outside. Her legs brushed against my pants, and my partner got some fluid on him that damaged his pants, which looked as if someone had thrown acid on them. The police had us on body camera throwing up. We transported her, and she died 3 days later from sepsis. The police decided not to pursue charges against her husband because he was too old. I was 19 and had 4 months on the job when I received this call. My first year was a trial by fire. Story 41. I have talked to numerous medical providers and heard some truly tragic, insane, and unbelievable stories. This remains the most unfortunate and extreme. I was coming off a 24-hour shift in the intensive care unit when I was an intern. A woman had met up with some friends for Bible study and decided to spend the night at her friend's home. At some point during the night, the friend checked on the woman. Upon opening the door, she found the woman and 2 items covered in a significant amount of blood. I will pause the story for a moment for you to consider what those 2 items might be before continuing. The woman and the 2 items covered in blood. The woman was alive and the 2 items next to her were her eyeballs, both completely removed. She had forcibly removed both her eyeballs with just her fingers. The paramedics brought her eyes with her in small saline bottles. You could see the optic nerves coming out the back, and the attachment points of the extraocular muscles that help move the eye in different directions were also visible. A clear liquid was seen running down her cheeks. Initially, I thought the liquid was tears, but it was cerebrospinal fluid leaking from the little holes in the back of the eye socket where the optic nerve enters the brain. It turns out she was diagnosed with schizophrenia and, as we believe, read a Bible passage that mentioned something about, if your eyes cause you to sin, you should gouge them out. She survived but is now blind for the rest of her life. It is a tragic story. Story 42. I worked in a pathology laboratory. A pathology lab is where all the biological samples, such as tumors, moles, limbs, bodies, deceased infants, and histological specimens, are analyzed. It's a world of wonder. One day, a leg arrived from a severe diabetic who chose to let his necrotic leg fester. The experienced physician assistant who was dissecting the leg suddenly stepped back in terror and exclaimed, "Holy cow!" and then dry heaved. This physician assistant performed autopsies regularly and was grossed out. When the pathologist cut into the leg, maggots poured out. This leg was attached to a living, breathing human just hours before a mobile home for maggots that were munching away while he was likely sitting at a diner days earlier. Story 43. I was a medic in rural Nevada. I received a call for an elderly man who had fallen in a casino parking lot. It wasn't severe, but he had a significant laceration on his forehead, and elderly individuals tend to bleed a lot from head wounds. While I was tending to him, there was a knock on the ambulance window. I assumed it was a friend or relative. However, when I opened the door of the ambulance, which was covered in blood, a woman rudely informed me that I was blocking her car. Story 44. A 4-inch centipede was coming out of the nose of a late-stage, Totally incapacitated female Parkinson's patient in a nursing home. I dropped her meal tray and just cried. That was 30 years ago when I was a nurse's aide, and it still haunts me. Jack Kevorkian has been my hero since then. She lived another 4 years under those conditions, and it felt so wrong. Story 45. The saddest experience I had was with a dementia patient. In the last 8 weeks of her life, she would cry and repeat the same phrase over and over. It turned out that the phrase represented one of the worst days of her life. The woman was reliving her worst day repeatedly every 10 to 15 minutes, crying intensely. This was not a normal sort of crying. The pain was so evident in her cries. I have never wished for euthanasia to be a reality more than I did for that woman. Story 46. I had a patient develop rhabdomyolysis after masturbating for nearly 72 hours straight while on a psychiatric hold. He was relentless. Story 47. Swallowed needles. He had about 6 in there. The X-ray was shocking. Apparently, he regularly swallows things he shouldn't. Story 48. I've seen people break windows and severely injure themselves. I've peeled drunk individuals off the sidewalk where they were frozen because they had an accident. I've pushed 3-year-olds away from their mothers who were dying from a drug overdose. I've pulled people out of compromising situations to perform cardiopulmonary resuscitation. There have been babies thrown in dumpsters during winter. I had a regular who rented his colostomy bag for others' use. People without community are often found weeks later, their decomposing bodies starting to merge with the surrounding environment. There are instances of suicide, knife fights, gunshots, and machetes are common here. I've entered drug dens and gang hideouts. What surprises me is not the absurdity of situations anymore. It's who survives and who does not. Those who endure unimaginable trauma often walk away, while something as minor as a stubbed toe can lead to septic shock and death. I don't save anyone. Death chooses its time, not us. Story 49. Just last week, there was a patient who kept inserting items into his urethra to obtain pain medication. He had put in styrofoam from a cup, rolled up paper, medication, silverware, and coins. There were likely more items as well. Story 50. The fire department quickly requested emergency medical services after a lift assist. The individual had advanced skin cancer, and half of his face, neck, and chest were severely affected. The condition was at various stages of decay, with his nose missing, exposing the nasal and oral cavities through what remained of the roof of his mouth. He signed a refusal and wanted nothing to do with the emergency room or the medical team. The fire captain was frustrated that we didn't just take him, stating that he was in a serious condition. However, he has the right to refuse medical care if he chooses. Story 51. Some guy is lifting police tape to walk his dog through the scene instead of going around. There was, until recently, the contents of someone's head on the road. Read the situation, mate. Story 52. An extremely elderly woman was left naked in an empty bathtub, so her family could clean her due to incontinence. She was left there for days, emaciated with large open sores and in horrible pain. She lived for a couple of days before we called the police. Story 53. My brother is a volunteer firefighter, and they were called to the local drug house for a possible overdose. A police officer had arrived before them and could administer Narcan. One of the other residents of the drug house panicked and thought the officer was there to arrest her. Her solution was to climb onto the roof of the 2-story house and fly away. She did get to fly, though, in a medical evacuation helicopter. Story 54. The patient presented with a skeletonized calf and foot while still attached to the rest of the limb. They had been abused and neglected by their caretaker. I have seen many cases of critical limb-threatening ischemia, but this patient literally had only bone and a small amount of tendon remaining. It was as if the limb had already been picked clean by vultures and maggots. The patient ultimately required a full amputation of the leg due to an infection that had spread higher up. Another unforgettable case was a rodeo clown who came into the emergency department after being pushed down and trampled by a bull. His testicles were completely pulverized, with nothing left to save. I believe he ultimately underwent plastic surgery and received prosthetic testicles. Story 55. I am a firefighter who performs many animal rescues. I witnessed a pit bull jump off a four-story roof and land on the concrete driveway. The dog was completely fine and ran up to us, wagging his tail as if it were a game. Not a single injury occurred. The fall must have been at least 40 feet. Why is it that when I misstep off a curb, I am out for a week? Story 56. I am an intensive care unit nurse. The things I find most troubling are not what most people expect. It's human behavior. Anyone who works in this field understands this. I don't witness some of the situations paramedics encounter, like young families tragically lost on the road. But I do see people mistreating their elders long past their time. Here are some of the more shocking things I've witnessed. A young firefighter impaled through one eye to the opposite side of the skull. I received him from the operating room, and it was critical for him all night and for weeks afterwards. He is still alive and doing okay, though I believe he is blind on one side. A point-blank shotgun blast to the thigh. 2 tourniquets were applied. Flesh was held on by only a few inches of skin and a bit of muscle. I think she managed to keep the leg, but I don't know how functional it is. A car crash resulting in massive head trauma, with brain matter herniating out of both ears. Unfortunately, he did not survive. Beaten to death with nunchucks. A call about an unidentified woman. Strangled, likely deceased for some time before being found and resuscitated. She did not survive. A person remained in a burning house, and I slowly suctioned charred lung tissue from his endotracheal tube over several days, as his respiratory condition worsened. A face destroyed by a buffalo. I have many more stories, but these are just the ones that come to mind. The most dangerous activity we all engage in is driving. If you operate an open-air vehicle like an all-terrain vehicle or motorcycle, I strongly recommend securing good life insurance and establishing a solid will and power of attorney. Story 57. I was a nursing student a few years ago. During my clinical rotations, I witnessed a lot. In 1 week, I saw one of my patients lose more of his foot due to progressing gangrene that we just could not manage for some reason, a colostomy bag seal failure that started draining into an open wound bed, a patient with jaundice so severe that I thought he stepped straight out of a cartoon, and I was bitten by 2 different dementia patients, one of whom had a Clostridium difficile infection. I didn't stay in the program very long, but I will never forget my time working in the hospital. For those wondering what happened, I was pursuing nursing through the Army, which condensed a 4-year course into 1 year. Unfortunately, my instructors were not well equipped to meet the demands of the new licensing exam. That is often the issue with pilot programs. Instructors are also trying to figure everything out, as the Army did not allow for perceived failures in testing. Story 58. Emergency medical technician here. We had a psychiatric patient who only calmed down after receiving enough tranquilizers to sedate a large animal. Story 59. A man cracked an egg into a needle and tried to inject it to boost his testosterone levels. This resulted in a massive infection that led to several weeks in the hospital. He recovered well and enjoyed the attention from the healthcare workers. For additional context, I worked in the developmental sector for a while, providing supportive housing to individuals. This was a transgender man who received testosterone injections in-house from a nurse every other week. The needles and testosterone were kept in his unit. He never used the testosterone without the nurse's presence, but after doing his own research, he read online that eggs could boost testosterone levels. He mistakenly thought injecting it would be the most effective method. When he came to the unit where I was working, he was very scared, crying, with a very red and inflamed arm, saying, "I think I made a mistake." Emergency services were called, and the medical supplies in his unit were transferred to a locked cabinet for the remainder of his time with us. Story 60. I had an intersex patient but wasn't aware of his condition. I went to assist him with the bathroom, and he had a small scrotum but no penis. He had also been inserting toy trains into his rectum. When asked why he didn't use safer sex toys, he replied, "I'm not gay." Story 61. I will tell my father's story of being an X-ray technician in Vietnam. I always thought it was safe, but it was not. He had to take pictures of what weapons of war do to people internally, including children. To see X-rays of children and babies shredded by bullets and shrapnel internally, How could anyone bear it? Story 62. An elderly man became delirious after suffering from a tibial plateau fracture. He removed his dressing and harmed his own leg, literally digging his fingers into the incision and consuming his own tissue. He developed an infection and required a lower leg amputation the following week. But fortunately, he did not remember the incident once the delirium subsided. Story 63. As a former emergency medical technician, I was dispatched one night to a parking lot by the police for a fight. When we arrived, the officer's expressions indicated it was a serious situation. Two sisters had gotten into a fight over a boy, and one of them bit the other's middle finger clean off. We spent about 5 to 10 minutes searching for the finger in the parking lot, and my partner finally found it. However, it wasn't a clean bite. It looked as if the girl who did the biting had gnawed on it extensively before spitting it out. I could never understand why she would chew on the finger. Story 64. I work in acute rehabilitation, which is not as chaotic as an emergency room, but I encounter some challenging cases. First, there was an elderly woman who had clearly not been cared for at home. Her toenails were so long that they curled completely under, resembling the horns of goats. The worst part was that she had a prolapsed uterus with pressure injuries. I cannot understand why none of this was addressed during her hospitalization. It seemed impossible that no one noticed, and they should have reported the family for negligence. But they didn't, so we had to. A patient in cardiac rehabilitation after a coronary artery bypass graft collapsed in the bathroom, and we performed cardiopulmonary resuscitation. His incision opened during compressions, resulting in blood everywhere. We called emergency services to return him to the hospital where he had his surgery, and he came back to us post-surgery, did well, and was discharged home. Another case was more emotional than graphic. A patient with a traumatic brain injury was very mobile but cognitively impaired. He became aggressive and uncharacteristically mean. His wife, a nurse, was supportive during our teaching sessions. On discharge day, he kept insisting that she would come, and we reassured him she would. Hours passed without her arrival, so we called her but received no response. We sent police for a wellness check, finding her in the bathtub after ingesting a bottle of pills and an entire bottle of wine. She survived and admitted she felt like a failure for being a nurse but unable to cope emotionally with her husband's significant cognitive and emotional changes. He went to a nursing home while she was in the hospital, and I'm uncertain if he ever returned home. The second case involved a patient with end-stage Parkinson's disease. His family had been withholding information from the outpatient neurologist regarding his decline, insisting that it wasn't as severe as it was. I suspect their reluctance stemmed from embarrassment due to his aggression and hallucinations, as well as their desire to keep him at home despite his condition being more than they could manage. His wife had just been discharged from the hospital and came in with their daughter for a visit. He became aggressive, swinging at his daughter. In an effort to avoid being hit, his wife moved back, fell, and broke her wrist. She passed away a few days later from multiple pre-existing conditions and complications. We discharged him, and he died a week later in a nursing home. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.